Hi, I'm Aaron and welcome to my channel, Healing with Aaron. So in this video, I'm going to be talking about my own experience of having weight loss surgery and answering some of the questions that I get asked commonly and maybe busting a few of the myths that exist out there about weight loss surgery. So I have to start by saying that, I'm not a medical professional. And this video is not intended to be promoting weight loss surgery or a doctor or, a medical institution. So if you are interested in having weight loss surgery, please discuss that with a healthcare professional. So the first thing that I get asked a lot is, why did I decide to have weight loss surgery? And, why didn't I try and lose weight the traditional way? I did. Many times unsuccessfully over the years. I tried so many different, fad diets. I tried exercise where I would, diet and exercise for a period of time. I'd lose some weight, then you sort of creep back into those unhealthy habits and then you kind of undo all of the work that you've done and you regain the weight. So traditional dieting and exercise didn't work for me, and it's different for everybody, really. I've opened up in some of my previous videos on my channel, that I struggled with my mental health over the years. I suffered from anxiety and depression, amongst other things. And I had a very unhealthy relationship with food and alcohol. And over time, over about 20 years or so, my weight crept up and it got to a point where I was extremely unhappy within myself and also with my weight. And I felt like weight loss surgery was the only option that would work for me, really. So it's important to say that I did a lot of research myself before I had weight loss surgery, and I carefully considered it for about a year and a half, maybe a year or so beforehand, before I even reached out to, a surgeon to have that first initial consultation where I looked at the pros and cons. I considered other types of surgeries, and the procedure that I landed with and I felt that was the best for me was a gastric sleeve or a sleeve gastrectomy. And the main reason that I chose that type of surgery is because it's permanent, it's irreversible. People who have the surgery, on average don't tend to regain the weight that they've lost. And it also had the lowest rates of complications and deaths as compared to other types of weight loss surgery. So I had a gastric sleeve, and that involves surgically removing 80% of your stomach. So they cut into me, they cut out 80% of my stomach, which is the majority of my stomach. They stapled it back up into a tiny pouch, which obviously means that the size of my stomach is now drastically reduced. So I eat a lot less. You could say that I eat in one sitting or in one meal, I eat 20% of the volume of food that a regular person does. So prior to having the surgery, I did have to have, a number of consultations with the surgeon, also a nutritionist, and I also had to undergo psychiatric evaluation because of my pre-existing mental health conditions. And also people who undergo weight loss surgery, that can be a big, drastic life change in terms of your new life and your new normal, and that can be difficult to navigate mentally. And if you have, pre-existing mental health conditions, some people can struggle with that. So yeah, I did see a psychologist and undergo a psychiatric evaluation. So I had to jump through a lot of hoops before I could even, be booked in to have the surgery. So I decided to have the surgery in the UK. I know some people who have had the surgery decide to go overseas. Perhaps maybe that's to do with, it being cheaper, so the cost really. But I decided to have it in the UK, mainly because I tend to worry. And I know everybody knows that the standard of, healthcare in the UK is much better compared to other countries. So yeah, I was worried that something bad would happen if I went overseas to have the surgery. So that's the reason why I had it in the UK. So in terms of preparations, before the surgery, you have to go in a pre-surgery diet. So in the 6 weeks before the surgery, I had to go on a liquid diet of just protein shakes. And I remember that vividly. That was quite hard to do. I would have 4 protein shakes a day. So that's about a 800 calorie a day diet for 6 weeks. Yeah, that was tough, not being able to eat solid food. And I was quite tired all the time, very low energy. And I used to get pins and needles in my legs, which was weird. So in terms of my actual surgery, I had that on the 21st of March, 2024. And the surgery was a success. It went well with no complications. I stayed in a private hospital overnight, just for one night, and I was discharged the following day. And I was in pain that first day, immediately after having the surgery, but that's normal and it's just part of the process. I remember immediately after having the surgery, once you wake up, the nurse woke me up and then told me that you have to go for a walk now. And I was not happy about that whatsoever. I was in so much pain and I was miserable. But yeah, I did it and it was fine in the end. So after I had the surgery, I had 2 weeks rest and recovery. I was mostly at home, in bed. And after that, you can sort of slowly get back to your normal life. And after the surgery, you have to go on a staged diet. So for those first 2 weeks, immediately after the surgery, you have to only have a liquid diet. And that's because, you've just undergone, serious surgery. You still have wounds and incisions inside. I have had titanium staples inside me. So I had to go on a liquid diet for those first 2 weeks. And after those first 2 weeks had passed, I could then go onto a soft food diet. So you can imagine the consistency of like baby food. And then after those 2 weeks, so that's 4 weeks after having the surgery, I could then introduce solid foods back into my diet. Yeah, so that was the post-surgery diet, which was fun. I didn't really experience pain after the surgery, apart from on that, first initial 24 hours. A little bit of nausea. I did experience fatigue, but then I sort of attributed that to, eating a lot less than I was used to. So it's kind of hard to tell the difference really. So since I had the surgery, I've lost about 192 pounds in total. I weigh about 161 pounds at the moment, which is 73 kilograms. My weight does fluctuate a bit because of the portion sizes that I eat, and I eat a high protein diet, and I'm physically active, so it does fluctuate. It goes up and down week to week. But yeah, my weight hovers around that mark. In terms of my sizes, I'm a small. My waist size is a 28 to 30. Before I had the surgery, I was a 3 times extra large, and my waist was 54 inches. So yeah, it's a big drastic change. So one of the questions that I get asked a lot is, do I have loose skin? The answer is yes, I do have a little bit of loose skin, mainly on my legs, my inner thighs. I've been really fortunate in that I don't have a lot of loose skin elsewhere on my body. I know that some people who do have weight loss surgery and they lose a drastic amount of weight like I did, they can have a significant amount of loose skin, but fortunately that's not been the case for me. I think probably genetics is probably the biggest factor there. And also I do a lot of cardio, and I was reading that, cardio, when you do running or, exercising on a bike like I do, your body and your skin, it expands and contracts. And as part of that process, it can minimize loose skin when you lose weight. But who knows really, it's probably just down to genetics. But yeah, I've been really fortunate that I don't have a lot of loose skin. Another question that I get asked a lot is, what types of food can I eat? Now it's been over a year and a half since I had the surgery. I can eat whatever I want, really, but I focus on protein. Protein is one of the essential building blocks for your body, so I have to prioritize that. So I eat a lot of meat and high protein foods. I find it difficult to eat heavy carbohydrates sometimes because they leave me feeling very full, especially things that are really heavy and stodgy. And I noticed as well that I can eat more of protein, like chicken. I can eat a lot of that, whereas with heavy carbs, I can eat less. So I'd rather eat protein than eat loads of heavy carbs, really. It's just a personal choice. Another question that I get asked is, how much food can I eat in one sitting, and what kind of portion sizes do I eat? So the size of my stomach can accommodate around 200 grams of food at a time, or 200 milliliters of liquid. So sometimes I weigh my food. I've got scales in the kitchen, so if I'm doing batch meals, I'll put them into containers and I'll weigh out 200 grams in each container, and then I know how much I can eat in one meal at a time. But then it also depends on which type of food I'm eating. Like I just mentioned, if it's like a heavy carb compared to protein, then I wouldn't be able to eat the full 200 grams of that. So I kind of know my body now, and I know my stomach size and how much it can accommodate at one time, depending, on the type of food. So I just kind of adjust it accordingly, really. Another question I get asked a lot is, am I in pain when I eat? The answer is no. I'm not in pain when I eat. However, the feeling of fullness comes on very suddenly for me, which is called constriction. So I don't know, everybody's body's different really, and some people, it takes them a while to feel full. But for me, it's immediate now. As soon as I feel full, I'll stop eating, because if I go over that and carry on eating, I could potentially make myself unwell or, be sick, which is not fun. I actually had an experience, I think it was on Christmas Eve, where I'd been out all day shopping with my family, and I hadn't stuck to my eating schedule like I normally do. And when I got back to my sister's house, we had ordered Chinese food, and because I hadn't eaten in hours, I was starving and I ate too quickly. I misjudged the amount of food that I had eaten, or, you know, that I could accommodate. And I was in excruciating pain. But it wasn't just the pain, it was that feeling of when you know you're going to be sick, but you're not sick yet. It was like an hour and a half of being in agony. My mouth was watering, and then I was sick afterwards, which was horrible. But yeah, I know now not to do that, not to misjudge how much food I can eat. So I'm quite strict with my portion sizes now, and also which types of foods that I do eat, because I don't want to get into a situation again where I'm unwell, because it's not nice. Another question that I get asked is how often do I eat? So I aim for around 5 or 6 meals a day. But between each meal, I have to wait 30 minutes and then drink water. So you can imagine, I have a meal, I'm full, I stop eating, I have to wait 30 minutes. That's because my stomach needs to empty, and then I can drink water again. And it's important that I do drink water between meals, because then otherwise you can get constipated, which is not fun and nobody wants that. So yeah, I have to obey the 30-30 rule, and I have to eat each meal slowly, just to give time for the food to go down my esophagus into my stomach and settle properly. So I make sure that I eat slowly, and each meal takes me about 20 minutes to eat. And after that, those 20 minutes, I'll stop eating, wait the 30 minutes, and then drink water. So yeah, it's a lot of rigorous planning and mental gymnastics. So another question that I get asked is, do I drink alcohol? The answer is no, I don't drink alcohol. I gave up drinking prior to having the surgery, which was a prerequisite. And since I've had the surgery, I just didn't feel the urge to go back to drinking. So yeah, I'm alcohol free now, and I have been for about, gosh, how long has it been? Since February last year, so that's, where are we, 19 months. I feel a lot more confident now and happier within myself, and I was mainly drinking for confidence, you know, or to escape reality, and I feel like I don't really need that anymore. I mean, people drink for all different types of reasons to enjoy life, but I don't rely on alcohol for that. So drinking is not really for me anymore. And also I've read a lot of things about other people who have gone through the same surgery that I have, or other types of weight loss surgery. And, you know, after you have bariatric surgery, if you drink alcohol, it can affect you a lot more than a regular person. So if you can imagine, because of my new stomach and my new digestive system, if I was to go back to drinking, alcohol would get absorbed in my stomach, in my intestines, straight into my bloodstream. So I would probably get drunk like that, only after having one drink. So I'd probably be a cheap date, which is not fun for anybody. So yeah, it's not for me anymore, and it's just not my thing anymore. So another question that I get asked a lot is, can I drink, carbonated drinks or fizzy drinks? The answer is no. I don't drink fizzy drinks, and I can't. I've been told by my surgeon and also my nutritionist to avoid them because my stomach is, so tiny. Carbonated drinks, so any kind of fizzy drinks, including things like champagne or prosecco, sparkling water, Coke. If I was to drink them, they would bubble up in my stomach, and my stomach is so small. And my surgeon told me that one of his patients told him that drinking fizzy drinks, the analogy that they used was that it was like drinking shards of glass. So it's painful. So that put me off drinking anything fizzy forever. So no, I don't drink fizzy drinks or anything fizzy anymore. Another question that I get asked is whether or not I eat sugar. I do, yes. I have a sweet tooth, but I have to be very careful with my sugar intake. I sort of introduce things into my diet, and then I see how my body, reacts to it, and then if it works for me or if it doesn't, then I'll sort of adjust it or remove it, altogether. But with sugar, if I, ingest too much sugar in one portion, I can get, a blood sugar spike, which is not fun. But also the opposite is true as well. If I don't eat enough, I can potentially have a hypoglycemic attack, which I have had before. So I have sugar in moderation, is what I'm trying to say. Another question that I get asked is whether or not I've had any sort of body changes in myself since I had weight loss surgery and since I lost so much weight. Yes, I have. Some of the notable ones is, I would say the quality of sleep that I have now. When I was a lot heavier, I would sleep, for like 11, 12 hours at a time. And I'd wake up and I still didn't feel rested in the morning or the afternoon sometimes if I was sleeping in. But now I can function on a lot less sleep. I tend to be averaging like 5 or 6 hours sleep a night. Sometimes I can even function on 4 hours sleep, which is like the bare minimum for me. But yeah, that's a drastic change, really. Another change that I've noticed is that since I lost weight, I do have a lot more energy in myself. But obviously you can imagine that I was carrying around so much weight before, whereas now I'm not. I'm also a lot more physically active. So it is a result of having the weight loss surgery, but also, all of the other changes that I've made. Another question that I get asked is, do I have stretch marks? I do a little bit, but I think that's normal in general for people. But I wouldn't say that I have, significant stretch marks. But I do have quite a rigorous skincare routine. And of course, like I said before, genetics comes into that. For years now, I've been using a all over body moisturizer, which is cocoa butter. So that in combination with the genes that I've got from my mother. So no, I don't have, significant stretch marks. Another question I get asked is, do I have reduced appetite or am I less hungry? I would say that yes, I was in the beginning, straight after I had the surgery. And that maybe lasted for maybe 6 months or so, but it's different for everybody who has weight loss surgery. But you know, your hunger does come back after a time, and yeah, no, I don't have reduced appetite at the moment. I feel hunger similar to how I felt before I had the surgery. Another question that I get asked is whether or not I crave different types of food now. And I would say yes. My taste buds have changed, which is weird. But I think it's to do with, you know, the chemical balance within your body and your biome. And because I eat a lot healthier now, things that I didn't like before I had the surgery, I now like. Things like olives and bananas and peanut butter. I really like them now, and I did not like them before, which is weird, and I eat them regularly. And then on the flip side, things that I did, you know, love or crave, like takeaway or takeout. I used to love Chinese food. I used to have Chinese every Sunday. I don't crave them at all now, and I don't eat a lot of takeaway, really. I prefer to make food at home myself, or, you know, make my own healthy version of a takeaway. So yeah, my taste buds have definitely changed. So another question that I get asked is, why did I decide to have surgery, and why didn't I have weight loss injections? And the truth is, honestly, I didn't know much about weight loss injections at the time that I decided to have the surgery, which was, you know, back in late 2023. They weren't that publicized, at least not in the UK anyway. It wasn't until the following year when a lot of celebrities started to have weight loss injections, or they were rumored to anyway. So no, it wasn't in the forefront of my mind. I didn't know much about weight loss injections. And from what I've read about them, it's not permanent weight loss. If you stop taking them after a certain amount of time, you can regain the weight. And for me, I was looking for, you know, a permanent solution, which is why I decided to have weight loss surgery. So the main question that I get asked is, how did I lose so much weight in such a short amount of time? I did mention that in the first video that I uploaded to my channel, but you know, having weight loss surgery isn't a quick fix. I had to make a lot of changes in terms of my relationship with food, but also with exercise. So how did I lose so much weight in such a short amount of time? I eat healthy, I exercise a lot. So that's how, really. So the final question, which is one that I get asked a lot, do I regret having weight loss surgery? The answer is no, I don't. It's the best decision that I've made in my entire life. I'm so much happier now within myself. So no, I don't regret it at all. My life is different, yes. I have to eat different things now, yes, but that's the decision that I made. So it's not something that I regret. And I'll just say again, if you are considering weight loss surgery, or you would like any more information about that, please reach out to a healthcare professional. I did have a lot of consultations and a lot of support from both a surgeon and a nutritionist with aftercare. So I've had a lot of help on my own journey. So thank you so much for watching this video. Don't forget to like and subscribe, and hit the hype button if you liked this video. That would help my channel a lot. Thank you so much for watching. Have a nice day. Take care.